We have a few clinical trials, for example, a clinical trial about the dual blockade in HER2-positive disease using two drugs that are called lapatinib and trastuzumab, and a very short period of treatment of only 11 days has led to quite impressive results in terms of reduction of the tumor. Now, of course, that is only a proof of principle study. It has to be proven forward, and then eventually, later, we may be able to identify who are the patients who can do very well without chemotherapy and just with those two targeted agents. Then another issue that we discussed was the characteristics of breast cancer in male patients. So we had a late-breaking abstract looking into the pathological characteristics of breast cancer in male. And this is part of a very large consortium called the International Male Breast Cancer Program. Very important because nowadays we treat men as if they were women with breast cancer. Because it is a rare disease in men, we have no clinical trial data, and we extrapolate from the female breast cancer field. Obviously, this is not optimal care for the patient, and we need to understand better the disease so that we can also provide better treatment for male patients. Also, inside the oral presentation, we had a couple of presentations coming from the Netherlands. And these are, let's say, the first fruits of a very large initiative and the Netherlands is very well organized in terms of registry. They have a centralized registry that not only has demographics and clinical information, but centralized pathology registry. So they are able to look back into thousands of cases of the different cancers. In this case, we are interested in breast cancer, but they do this for every type of cancer. So they start looking into this huge database and extracting important data that can then be used to reorganize cancer care and to, let's say, focus on areas that clearly need to be better organized and to provide better quality of care. So a few papers on that are also very important. And then we also had a presentation related to the advanced breast cancer report, which I believe we will speak a little bit further away.